I work for SUI. SUI stands for Central Institute of Ultrasonic Instrument, and it is established in the year of 1978. So it's almost 40 years remarkable in medical ultrasound industry. The headquarters is based in the Santo, and they do have offices in the other parts of the world. They are doing marketing worldwide right now, and they have almost more than 50 offices in different parts of the world. So here I am going to represent you the portable model of this SUI, which is named as the Apogee2100. In this platform we have two models exactly same, but differentiation between some applications as well as channel. So we have the another model called as the Apogee2300, but I am going to show you 2100. What's new in this portable model? The first one is it's very compact image, like it's very compact to use and travel inside the hospital. Then you have two probe connectors in the back side of the machine. You have probe holders attached with this, and then you also have the peripherals to attach your USB and then HDMI and then VGA connection. So there is not complicated version, it's very easy to use as well. So when you open this, it's look very beautiful and very slim model. You see the screen size is 15-inch and your application area is 13 centimeter, which is as good as in standing machines. Also, you can use this screen to tilt up to 40 degree. This is very useful because mostly in portable model, when you sit and do examination, you have to bend down. But SUI 2100 giving you liberty to stand the screen up to 40 degree according to your chair size, your height and your examination. This is also very useful when you do biopsy. You cannot do biopsy by sitting, so when you're standing, if the screen is like this, there will be no needle enhancement much, so you can just tilt out your screen and you can see needle enhancement very easily. So that's the beneficial we have in our portable model as well. Now if I talk about these softwares which this machine is upgraded, it has all the softwares which we do have in standard machines. Like we talk about X-beam, which is a sonicity or compound imaging. Then we have nano view as well, which also you can set the level in this. You have THI, tissue harmonic imaging. You do have frequencies setting options as well. So these are few software which makes image enhancement, which you are finding in standard machines as well. The other packages, if we talk about, you do have VS Flow in this, and later I'll describe with the knobology with this machine. So this machine is capable to doing all the examination, including your abdomen, your vascular, your OBGYN, including 4D, and then cardiology, of course. So let's talk about knobology part of this machine. It's very simple, it's not much complicated. You can see all modes are together and their gain are into the same button. This machine is also have the feature called auto fit, which is an intelligent optimization feature. So what does this intelligent optimization do? When you activate B mode and press this gain mode as auto fit, it is automatically adjust your gain as well as your TGC. So you need not to worry about your gain when you're working with the patient, so you can focus more on patient for the diagnosis rather than doing settings on the machine. Then you have M mode, which is there to calculate fetal cardiac activity and also urine cardiology for motion activities. Then you have color mode. You do have PW, which stands for pulse wave. For cardiac, you have CW, which stands for continuous wave, and then we come for the left part, which is basically the display of imaging settings. In menu, once you press this, you get these parameters, which is for the image enhancement, and you can change by pressing menu over here. Then you have split image options in twice, and also you have for 4 image split, which is very useful for calculation of AFI, stand for amniotic fluid index. Next you have scale and the base, which is very useful parameters to set the color as well as pulse wave Doppler. Again, if you come more on the left side, you do have options for enter ID, to select the examination, and then end exam. And here you can see the 4D button, which is quite kept separately. If you are doing 4D, you will be not much confused. You have 4D option very clearly over here. You can see 3 knobs over here, which is activated right now in blue color. In the same knob you can activate actually 2 functions. One is for angle, another one for steep. Once you press this, you can actually activate the another part. Same as a zoom. If you want to zoom the image, once is there manually you can zoom. Otherwise you just press the zoom and the particular area can be zoomed. So this is for the zoom button, and to set the depth, and then to set the frequency and THR, you have option in same knob. You just press this and rotate this, the function will be activated. So it's very simple to use. Here you can see some hotkeys: F1, F2, F3, F4. It is actually partiated with some other keys, which is means something. So before F1 you have something related to smart archive and report, which is for your reporting purpose. Then between F1 and F2 you have for display of imaging, whether you want to display it in full screen or how you want to set up your layout. Then again between F2 to F3 it is related to your inversion of color, inversion of your beam mode, left and right, black and white split. So this is related to your display setting, how image you want. The buttons between F3 to F4 you can find triplex, which is activated for beam mode, color mode and pulse wave light, that is known as triplex. Then you can set the range actually, between what range you want to get the triplex, and you have automatic calculation, which is known as trace. So after F4 you have the parameters for your biopsy or ECG as well as your panoramic activity. So here we have all already inbuilt softwares which we are already described. To do the examination, now we need to go for the examination, how to perform in this machine. So here how we perform examination in this. First you need to enter some ID. So here you just press the ID and then you get details, structure, like you need to enter last name, first name, and then if you want to create ID you just untick this, and then you can write your own ID. Here you can select the examination which you want to perform. So right now I have connected linear probe. You can connect 2 probes at a time, so maybe you can connect convex. So I'm selecting here small parts, right? Here you will get the comments if you want to write, study description, sex, date of birth, age, height. So you can fill this according to your use and then save. So this will give you new patient data, and now you can actually start the examination. To start examination, just press this exam and you will get the 2 probe connected over here. Right now I have connected only one, so it's with linear, and we can see we do have presets already made related to the linear preset. The examination which can be performed by the linear is already made presets over here. So you can see carotid examination with this, and also we can do MSK, pediatry, superficial, small part penetration, peripheral veins very nicely with this linear frequency. So I have just selected carotid presets. So Now I would like to show you the split of image, how it should be performed. So if I want to take carotid in two places, you just need to active this and then update. So the screen will be splitted in two sides. Again press this for 4 images. This is how you can take AFI measurement by splitting images into 4. So just to go any places you want to go back, just press B mode and you'll be back to your 2D mode. For AutoFit, as I mentioned earlier, just press this gain button and it is automatically optimize the gain and TGC of the knob. So here I am going to demonstrate live carotid with because of some adjustment which you need to do in color, how to activate color mode, how to activate pulse width, how to stray angle, how to support for baseline and scale. So this is the live carotid measurement which we are going to take. We have scanned the carotid part. And now here you can see C, which is the color mode. Just press this button and the color mode is activated. To steer this box size, you have a steer option. So just you can steer angle with this. And then at the same time you can see you have options called scale and baseline. When you put color mode on, the scale line is automatically get highlighted. If you need to change this scale, you can press from here and you can change the scale actually. And then again, if you want to go with the pulse wave, you just press this PW mode. To change the gauge size of the pulse wave, you have options here. Here we can change the gauge of color, and for pulse wave, you need to change steer angle from here. Press this again, and you can change angle from here, the direction in which your blood flow is. So here we have done for the pulse wave. Now just press PW to activate it. This is the image we are getting it. To change the baseline manually, you have option called base. Just press this and you can change the baseline actually. And again, if you want to change the scale, just press this scale as well. So here we are set for pulse wave. You can change angle by steering here. And to change the scale and baseline, you just press the particular baseline and you have value button over here. You can rotate from here and change the baseline and scale. We're just activating this. And suppose I need to change the baseline manually, you can change from here. And scale, if you want to change, you can change that also from here by pressing and then rotating this value button. So now would like to tell you, this is the manually thing you can do, but sometimes you might be in hurry and you don't want to do so much of settings. So you just press this auto fit and then the machine will automatically enhance your baseline and the scale according to the part you are doing scanning. So this is called the power Doppler intelligent optimization. Again, to get the measurement for this, we have option called trace here. So just press this trace and you get the live measurement as well. After this, you can freeze it. The machine will get you the best cycle which can be measured done. But still, if you want to change the cycle content over here, you just move with the trackball and you can see the measurements get changes. Measurement get changes. One more feature we'd like to introduce over here, we now might be the organs or the vascular parts which you are doing has moved. To see them is light, we have option called triplex. By pressing this, you have the B mode live, you have the color live, and then also you have the Doppler live. So there is no need to go again to B mode, then to press color, and then to do the power Doppler settings. Just press on this triplex and you can see easy measurement done by the machine. So Doppler doing in this portable model is as easy as we do in the standing machines. I'm going to show you how to take measurement in when you do OBGYN, and the same procedure can be applied for abdomen, small parts and the cardiology as well. So here you can see the calculation button over here. We have taken picture already for the BPT measurement. So just press this calculation, and as you see already BPD, SC, AC, FL and the other measurements are inbuilt in this list. This can be edited, that means can be added or removed according to the user list. So I'm going to take BPT first. Here I'm taking BPT now. Done. Then next we can go with the HC, which is standard circumference, and trackball to use the ellipse. And if you need to change the point, you just press update and you can change the another point of the machine. So here how we are taking HC and then set for the next measurement. In same measurement we will take the AC measurement as well by considering it as the abdomen circumference. And then the next measurement will be FL, femur length. So now you see the measurements are too much to over here. You cannot see this full position. So you can change the position of the measurement by pressing your P position. So now the measurements is in one side and your whole picture you can see over here. After doing this measurement and the calculation part, we can go to our next report page to see what our measurement gives effective fetal weights. Here the measurement which I have taken 8.67 as BPG, then FL, HC, EC, and according to this measurement I have it the fetal weight over here. This fetal weight is totally dependent on the measurement which we are taking, and then according to the measurement the ultrasound age of the baby, the gestation age is 32 week 1 day, and then expected delivery date is 2018 S3. So these are from the LMP and this is the measurement which we have taken. Next, if you need to edit the measurement, like if you want to see this in another formula, you can change from here. Headlock equation, table or Hensman table, according to your comfort level, you can select from here. And if you are taking 2 or 3 measurements, you no need to be worried out. From here itself, you can actually select which measurement you needed. Whether you need average, minimum, maximum or the last volume will be fine. Here you can find some ratio, SCEC, FLSC, FLBPT, FLEC. So this is your total report which you can get by doing the total measurement. The effective fetal weight measurement is selected over here with the measurement of EC, FL, BPT. You can select this also according to your comfort zone. If you don't want to take more measurement, go with the ACFL or ACBPT. It's up to you and your use. Next, in JAWN we can see some blocks over here where we can see the analysis part. Here you can write according to anomaly scan, which are you seeing, which are not. So this is up to you. Then go with the chart. This is the fetal growth chart which we are having in this portable machine. Now what it's showing is the EFW fetal weight measurement growth chart. This can be changed according to the view which you want to see, whether you want to see the growth of BPD, it's perfect or not, you can see there. This red sign is the indication whether the growth is perfectly or not, your baby is lying somewhere here. So this chart can be also done by your use like 1/2, 2/2, like 4 pattern, depends upon you. You want to see all pattern in different way, one in BPG, one in FL, one in HC, that you can select very nicely. All 4 chart can be seen together. So this is the way we are doing analysis, and we have report page editing chart over here. If you want to give a printout for this, then also can be done from here, print screen. And then if you need to add some pictures in your report, select this picture, and from here you can add some images to your report. This pattern is also selected whether you want to keep the format in 1 by 1 or you want to select it as a 2 by 3 or it should be 3 by 3. That totally depends on the user's setup, which kind of image they want. So this is how we can edit our report. Next, once we have done the patient, maybe patient leave for the day and you miss something, or the patient can come tomorrow or day after tomorrow after some time. So you need not to worry about entering all the details again. You have option called Smart Archive. Just press this Smart Archive and your patient details are all saving over here. You can find it by the patient ID, by the name, the age or the exam date, whichever is comfortable for you. So just select the person, the patient, open this and open this examination, and then you can start your examination with the same patient with the same procedure again. So as I was discussing earlier, this machine is also capable to do 4D, 3D and also the elastography. Here you can see the 4D image which we have captured earlier, and like in stainless machine, you also have the software called AnyCut. You can cut unwanted slices from there. Then we have N-Slice, which is also called it as a MRI scan, where you get the image from different sections, and also Q-cut and line cut. So this 4D is also compromised with all the features which we have in standing machines. This is the image which we are getting by doing 4D with this machine. Now let's talk about the elastography in this machine. This is loop we have already saved in this. So doing elastography is also very easy in this machine. We have already equipped software in keyboard which is F4, and we just activate it from there, and as you see you have 2D mode and your elastography mode. By doing elastography on thyroid, same you can do for your breast as well. Here you can see the color map over here, the hardness of tissue, softness of tissue, and the normal tissues can be coded with the different colors. This is the pressure bar where it will tell you how much pressure you have to be maintained in this. As the same process you can see, you can take calculation as well from here as a strain ratio, distance, ellipse and trace, and the area ratio. So these are the some advanced features which we have in portable model which others don't have. The elastography, the 4D, the VS flow. If we summarized about the softwares, we will have X-ray nano view, and then we have THI, and then VS flow, which is very high color sensitivity, which we have it in portable model. Also, at the last, I would like to make a note. This is so light to continue. You just cover it and carry it to the different places by removing from the AC power, because it has comprises of lithium batteries which can be work on 60 minutes without AC power. And when you open this machine, the image which you are taking in one place, it will be same. So there is no time for taking for rebooting system again and again. This is all for Apogee 2100.